First and foremost, want to thank everybody for joining us today. We're really excited to present on the topic of cyber threats, compliance challenges, and the growing chaos within the healthcare landscape, and why good enough IT simply isn't good enough anymore. Our goal really is for everybody to walk away with some valuable insights, right? Practical takeaways that you can bring back to your organization, really helping to identify, and address gaps, deficiencies, blind spots in your current IT approach. And before we dive in, we'll just do some really brief introductions here. So my name is Justin Krentz. I'm one of the principals here at Vertilocity. I focus primarily in account management and business development, primarily within the healthcare space, where I've spent the last 15 plus years. And over that time, I've had the opportunity to work with a wide range of healthcare organizations, primary care to orthopedic specialists to federally qualified health centers and long-term care facilities. So that experience has really allowed me to provide practical insight, into how technology can be strategically leveraged to help healthcare practices operate more efficiently and successfully. And with me today, I have Chris, and I will not attempt to butcher his last name, so we'll just refer to him as CJ. Chris is one of our technical leads. So Chris, you want to give just a quick rundown on yourself?
Sure, absolutely. So I'm the one of the network administrators here at Vertilocity. My team focuses primarily in the healthcare space. So we have about 30 clients that are all healthcare focused. And basically my team, just handles any kind of tickets that come in, problem resolution, and then also, proactive maintenance for servers and basically future planning, for that client to make sure that that they're ready for everything that comes at them, in the future for the IT space. So been in IT for almost 20 years now, and just have been, basically up through the ranks. So started as a lowly tech, and then all the way up to management. So I've seen everything.
Yeah, we're showing our age here, Chris. 15,
yep.
20 plus years at this point. So, Bree, you want to introduce yourself?
Yeah, absolutely. My name's Brianne Laffey. I'm one of the account managers with Vertilocity. My goal is to work closely with clients and build those relationships and have the discussions that are all things IT related, whether that be, changing an ISP or putting a new ERP system in, whatever the case may be, down to hardware procurement, okay? So I work closely with our IT specialists to facilitate those discussions and put you in touch with the technology savvy team that will be able to assist you with whatever your needs may be.
Perfect. Thanks, Bree. So let's jump over. So why are we here today? Bree, you want to give a little bit background on Vertilocity, who we are?
Yeah, absolutely. So we are a managed IT services provider. We do specialize in the healthcare space. There are many different forms of IT that we can assist with. We do have a team of security services group that will be able to assist with cybersecurity questions. We have virtual chief information officers that can assist with those higher level discussions to help kind of put together a roadmap and budget for upcoming changes to your anything IT related, really. We also have an enterprise resource planning group that specializes in accounting solutions that we can assist with. We implement those and resell them. And then we also have a group called the Modern Workplace Group that specializes in data analytics and some custom development. So, really, I always say whatever your question is, if we don't do it, we might know someone that can. So we are always open to having the discussion and helping you find the right solutions for your business.
Absolutely. Yeah, and I think it's really important to understand, right, our expertise in the healthcare space. So as Bree mentioned, we really help organizations, facilitate improvement in operations, ultimately, with the end goal of increasing patient care. So we look to position organizations, from a technology standpoint to accomplish that. And just some quick agenda housekeeping items here. So today we're going to cover 4 unique topics. first, the hidden risks of the IT generalist. Then we'll dig into what sets a healthcare IT partner apart. We'll look at aligning technology strategy for growth and compliance, and then we will wrap things up with building resilient, future-ready practices. And also just want to mention there is a section where you can submit questions or comments, so we'll leave some time at the end of today's presentation to answer those, but please be sure to drop those in. If you have anything further that you want to discuss or dive deeper, include that as well, and we'll make sure we leave ample time to address those at the end of today's discussion. So we are ready to dig in. Bree, I will hand things over to you.
Sounds good. Thank you. All right. So today's reality for healthcare practices. So, technology is constantly changing. The way that malicious actors can approach you, is always adjusting to, new AI technology and things like that. So what we're seeing is a rising compliance, complexity, and security requirements that we want to make sure that we're addressing with our clients. Cyber attacks are increasing. You don't want them to target personal health information, making sure that your EHR and that your hardware is up to date. Any upcoming changes to technology and software systems, we want to make sure that we're addressing those. And then, of course, tech fatigue, burnout, and stretched resources across the IT space. Making sure that you have the proper support so that you can operate efficiently, because ultimately our goal as an MSP is to make sure that our healthcare clients are able to see their patients and they don't have to worry about technology in the forefront. So generalist IT support often fails to keep up, leaving hidden vulnerabilities that compromise care and compliance. So what that means is that we want to provide proactive support for our clients and make sure that we are not, we are checking in regularly. We're planning for any upcoming changes to the practice, any changes in technology that we see coming down the line, as well as increasing our security solutions to keep PHI and HIPAA compliance. We want to keep everybody safe, operating, efficiently, compliantly. And putting together kind of a roadmap for our clients rather than having a reactive response to anything that would come up and become an issue within the practice.
Yeah, and I think, Bree, just to piggyback off of that, it's important to note, the generalist, the quote unquote generalist, right? They're not going to have the granular level understanding of HIPAA compliance, how patients flow throughout a practice, right? What's the inner operations, both on the clinical and operations side of a practice. So while they may be cognizant of, hey, we know, Windows 10 is going out of support, great. Or, hey, we know that there's this vulnerability, but there's so many other layers to it, when you layer in HIPAA and other, frameworks that you have to adhere to, that it makes it really difficult unless they truly understand how to navigate that. To be able to speak on those vulnerabilities and ultimately keep up.
Okay, so the IT model and why it's failing healthcare. So this is very similar to what Justin was referring to. So we are a HIPAA compliant managed IT services provider. We have a full team that is dedicated to our healthcare clients. So what's nice about that is they have knowledge of the EHR space. They are able to work closely with you on how your current environment is operating, what recommendations we would make. We're also able to provide, not just one person that can assist, but a group of individuals that have different skill sets and a team where we can escalate issues to if needed. We have a full security team that we're able to work with. And, it really speaks to how dedicated they are understanding your specific operations and how we can support you. Sometimes, you get one person in there, like I said, the reactive versus proactive solution. We want to be ahead of the game and seeing some issues coming that could potentially cause a riff in your practice, rather than you calling us saying, oh, we're down, we can't operate, what do we do next?
Right. So really, this just kind of has a couple of those bullet points that we were just talking about. Basically strategic versus general IT. With the compliance expertise that we have with our cybersecurity team, with basically we have HIPAA compliance specialists. That's what as a healthcare focused MSP we're bringing to your organization, rather than, like I said, that generalist IT model where they're basically just handling tickets as they come in. They don't have a specific understanding of how healthcare works, how patient flow works, like Justin was saying. So and that's just kind of what we want to focus on. And then of course there's faster resolution times with the proactive approach, rather than reactive problem solving. So basically, my team, because we have a team of healthcare minded tech support individuals, we're resolving those tickets that come in and trying to be proactive so that they don't happen in the future, trying to make sure that all of the safeguards are in place so that we are HIPAA compliant, stuff that the generalist IT model just really doesn't cover, where it's just working tickets, resolving issues, and then that's it, they're done. So that's one of the main things that we like to focus on. So and then again, scalable support that adapts to growth, rather than just having the higher risk of data breaches and fines, with having a practice that's not used to working with the healthcare individual, healthcare practice, just with the generalist IT model. So then the last thing, upgrade recommendations and roadmap, EHR and billing integration across the organization. So, generalist IT model, they really don't have those kind of integrations where they know what, different EHRs that are running, that are focused mainly on healthcare. We do have that experience where we work with multiple, EHRs and billing systems, and are able to integrate those across your practice.
And CJ, you want to provide some insight from a technical standpoint in terms of the hidden costs?
Yeah. So, again, hidden costs are the wrong fit. The reasons why choosing that generalist IT partner can cost you more than you think. And so we have a success story here for one of my clients, which is IVF Michigan and Ohio Fertility Centers. They had a generalist IT model. They just had a regular MSP that was not healthcare focused. Unfortunately, they didn't have the cybersecurity systems in place, or the I should say the cybersecurity team that we have in place, and they had a security breach. So that led them to a lot of costs, increased cybersecurity insurance, unresolved tickets that they had, and they were just basically overwhelmed. And there was one director of IT that was working there, and he was just pulling his hair out. So, we came in, we had a whole team, and the first thing that he basically told us was, it was like a weight got lifted off his shoulders, that he knew that he can kind of lean on us, get all that stuff resolved. We worked with him on getting the cybersecurity issues resolved where they had the data breach, changing passwords across the board and et cetera. So that was the nice thing, like he said, is just that, he knew that he can lean on us, and we had a whole team of people that just knew the healthcare space, knew what kind of compliance that they needed to be in. And we were able to get them back up and running very quickly. And then brought on, multiple other locations, since they joined us, and we're able to basically help them, get those locations spun up. I believe those were new builds, Justin, if you want to correct me, but those were just new offices that we basically helped them, get up and running in a short amount of time, so that they were able to expand their business basically all across Michigan and into Ohio. So.
Yeah, and I think, CJ, just to add some further commentary, a few slides back we talked about reactive versus proactive. I mean, this is a great example of that, right? Where they were effectively mismanaged for a number of years, which allowed for technology issues to just stack up, right? So they had security issues. They weren't very efficient in planning and budgeting and strategizing, right? They were out of compliance in a lot of capacities. So, being proactive and kind of forward thinking and being able to align and see what's coming down the pike really helps organizations be nimble to a certain degree, right? And strategize and plan so that they don't find themselves having a large investment, right? Because they couldn't foresee what was going to happen, or they spent technology in areas where they really shouldn't have because it didn't align with the vision, strategy, or compliance framework that they have to adhere to. So, it really becomes, positioning, finding a group that can position themselves as a true thought leader and partner with your organizations, and have a seat at the table and help guide and direct and make strategic recommendations that allow the organization, again, to plan accordingly. And Bree, do you want to touch on your group in Denver?
Yeah, absolutely. So this is one of our clients we meet with monthly. We had known probably about 6 months in advance that they were looking to open a third location for their dermatology practice. We were able to, take a look at the line items on their current month-to-month spend with us, break down, how many desktops they were going to need to purchase, how they were going to connect to their server, the firewall we were going to put in place in that office. We did an office walkthrough. We worked closely with the internet service provider to get things up and running. We helped them purchase their desktops. We staged them. We shipped them out there. We got everything, set up in place. And we were able to put a roadmap together for them, not just with the, initial costs in opening that facility, but also then what their spend was going to be month to month with our line items to support those devices and users that they were going to be adding to the group. So it really, because we have such a good relationship with them and they were able to, provide some detail on the actual space and we were able to see it, we were really able to have them up and running, as soon as they were ready to open and had the staff to facilitate operations in that building.
Okay, CJ, I'll let you speak here as well, since this is another one of your clients. So if you want to.
Absolutely. Actually, all three.
Yeah.
But yeah, so this was a major, ortho practice down here in Florida where I am. They had a local IT company that was generalist. They were not healthcare focused. They were in the midst of a major expansion when they came over to us. And so, one of the main things that we focused on was just trying to save them money. They had a big server farm and in-office, servers. They were trying to. They had multiple locations, so there was multiple costs involved of having to have all those locations interconnected. So what we did was, with being an Azure partner and having Azure experts on our team, we were able to move them to the cloud with a significant cost savings, eliminate a lot of those servers, eliminate a lot of the equipment spend that they had, and because of that, they were able to start looking at spending money elsewhere, and ended up acquiring 2 other practices in the meantime. And then with those practices, we were able to completely help them onboard them as they were acquired, and move them over to their domain and to all their integrated systems, and get them up and running with basically no downtime or interruption to patient flow. So that was the main thing, is we like to make sure that there's not going to be any kind of patient downtime or anything like that where it's interrupting their practice. So we were really successful with that, and that was one of a major wins for us.
Yeah, and I think CJ, I remember from original discussions with them, a lot of time we were asking the question why, right? I mean, the way that they had their infrastructure configured. Well, why is it configured in this manner? Why are you spending, in these areas and not these, right? It was a lack of proactive guidance and planning, because again, an IT generalist isn't going to think to ask those questions that are specific to practice flow, operations, understanding healthcare and how to navigate that. So I think, just the deficiencies there in truly understanding the nuances of that practice led to tens of thousands of dollars in overspend on an annual basis, right? So we were able to really lean out their technology, make them more efficient, save them money, put them in a more secure environment, which is a win-win-win, right? So we're able to partner with a large prominent healthcare practice in South Florida. They're able to save money. We can help guide them, and provide again, a cleaner operation from a patient flow standpoint. So that was
and the main focus now is they can look at the future spend and acquiring other practices and expanding their business rather than focus on IT, and we just handle that for them. They know that they're in good hands.
Absolutely.
All right. So what you should look for in an IT partner, and if any of these, you feel like you identify with them, feel free to throw any comments or questions in the chat if you have them. But do they offer proactive security monitoring and compliance updates? So we deploy tools on all of our client devices that allow us to monitor everything behind the scenes. We know when updates are going to be coming through. We're able to support them, patches, security updates, things like that. So we are proactively monitoring all of our clients and their environments. So that is one thing that, that's just a easy step in the right direction to be able to have those tools deployed in all of our healthcare environments. Do they have a deep understanding of EHR's clinical workflows and integration challenges? CJ, you and I have had many discussions around the EHRs with, software updates. We have a few clients that use iPads to open, client files, things like that. Making sure that, the iPads are updated when the EHR is going to be updating, making sure that we are on top of that so that when they come in first thing in the morning, they can open up, whatever their EHR is and use it properly and not run into challenges there. We have worked closely with a number of EHR companies that, we open tickets with them to ask, how best to support our clients. So really just kind of being open to understanding the ins and outs of how they work and then how we can support our clients that are using them. And then these last two, can they create customized roadmaps for technology? We kind of covered that a little bit. And then also, can they scale with us if we need more support? I think, what Chris just went through with the fertility practice as well as the orthopedic, we can see that, making those recommendations, putting together those roadmaps are very important. And then scalability wise, I think with the way that we meet with our clients and we have very transparent pricing and understanding of where those costs lie, we are able to support them, whether they're opening a new location or whether they might be, moving to downsizing in some degree. So, these are all important conversations that you should be having with your IT partner. And if you're not, you may be wanting to look for something a little more proactive.
Yep. And not only that, I want to kind of piggyback on that. We like to consider ourselves more on the white glove side too. So does your, current IT partner, call your EHR and open tickets for you? We like to just be a one-stop shop. Our clients know they can call us and say, hey, I've got a problem, and we'll do our best to absolutely take it from there. Did your ISP go down, or internet's out or something like that? We'll call the ISP for you. So that's one thing you can ask your current IT provider now. How far down that rabbit hole do they go? Are they kind of a one-stop shop for you? Because that's what we like to try to do.
Absolutely. Bree, you want to touch on, technology and aligning with growth?
Yeah, absolutely. So, we want to make sure that, again, EHRs are getting updated properly, that the devices that you're trying to access them on are also, HIPAA compliant and updated as well. Integration across EHR, billing, payroll, ERP, that's all something that our team can help with. Like I said at the beginning, if it's not something that we can do, we generally have, a team that we can work with that can support that as well. And then, expansion support, also touched on that a little bit. New locations, mergers and acquisitions, they happen all the time. We want to make sure that we are part of those conversations because we can offer advice and recommendations into how to strategically accomplish any upcoming changes to the size of your organization. And then enhanced patient experience through better connectivity. We have a number of tools that we use. Our ticketing system has a client portal where you can access your tickets. You can see, what the status of it is, who's working on it. And since we do have that dedicated healthcare group that does provide the technical support for our healthcare clients, they're very familiar with the users. They're familiar with the softwares that they're using. They know, what their processes are, so that they know when something's coming in that's urgent. So just being able to provide that additional support is very important for us.
Okay, CJ, you want to touch on the next steps here?
Absolutely. So really, this takes us to your next steps, from good enough IT to more of a strategic IT partner. So step one, assess your current IT setup and identify your risks. What hardware, software is currently in use, actively supported and up to date. Are you prepared for Windows 11, this coming October? Have you had those discussions? Do you know what equipment that you need to replace or what can be upgraded? Those are all, questions that you should be asking now, so that you're not running into issues, in just a few short months. Is the network and endpoint security properly positioned to combat present day threats? Is the data backed up and is it tested on a recurring basis? That's one of those proactive things that we like to do, is just make sure that we're, doing, data backup tests, making sure that everything is working intended, because it's one thing to know that you have backups running, but are they correct? Will they restore when the time comes and you really need them? So that's the a big thing, is just running those tests to make sure, we can restore as needed, when you do have a something that goes wrong. And do you have a well-defined user access management process with permissions, onboarding, offboarding? That's one of the things that we focus on, is making sure that, with HIPAA compliance, we want to make sure that people don't have access to things that they shouldn't have access to. Terminated users are terminated immediately. So all those tickets come in for us as basically high crit tickets, and with a large team able to focus directly on those, we can get those user additions or terminations processed immediately. So
yeah, Chris, I just want to jump in there before you go to step two. As a takeaway, regardless, I think that's something that everybody should be evaluating, right? More often than not, whenever we acquire a new healthcare organization, we find massive gaps, deficiencies in their access management process, right? So
yes.
Do we have a defined plan for onboarding, but also offboarding, right? If somebody's let go, how are we validating that they don't have access? Or are the files all properly stored and their credentials are changed so that they can't get back in? What are the permissions? Who has access to what? Right? That all needs to be well-defined, documented, so that everybody's adhering to that. So it's not kind of fly by the seat of your pants. Oh, hey, we're going to let somebody go. Oh, did anybody let IT know yet? Oh, well, we let them go 2 weeks ago. They've had unfettered access still to the entire environment. So regardless, I would put that as a takeaway for everybody. So just go back and ask that question.
And then step two, align the technology to compliance and business goals. So, create an IT roadmap that is aligned with your business goals. Where are you going from here? What's your future growth plans? Conduct technology and risk assessment to identify gaps or misalignments, and regularly evaluate your cybersecurity posture to ensure you're adhering to compliance guidelines. So, with having a cybersecurity, direct team that we have that are, they're HIPAA compliance specialists. That's one thing that we focus heavily on, is just making sure that we're regularly evaluating all of those different systems to make sure that everything's in compliance. You're not going to have any issues with your cybersecurity insurance provider or anything like that. So that's the main thing. Just these are takeaways, basically.
Absolutely, and I think the key word there being regularly, right?
Yes.
This isn't a one-time thing where, we talked about security in 2021 and we put these tools in place, so we're set, right? I mean, that is a moving target and will continue to be so, both from a compliance standpoint, right? So as they update guidelines there, but also just as threat, vectors and bad actors change the means by which they're trying to gain access. It's very much a cat and mouse game. So those evaluations, assessments really need to happen, on a recurring cadence, and whether that be annual at a minimum, but some groups quarterly, might be necessary if you're experiencing significant growth or changes to the organization. You want to make sure that security is at the forefront, really, of all of those discussions. So.
Yep, and staying proactive. I mean, that's the big takeaway that Justin was just talking about, is just making sure that you're doing those assessments regularly and being proactive with those, because that's where we run into issues. Like you said, there's that yardstick is always moving with those bad actors and what they can accomplish. AI has really made it very difficult lately. So that's something that is your generalist IT looking into how AI can improve the constant cybersecurity threat. And then, of course, step 3, evaluate fit, right people, process, and platform. Does your existing partner demonstrate proactive support and guidance, not just reactive help desk like we were just talking about? Are you partnered with an organization that is focused in healthcare, or more of just an IT generalist firm? So somebody who knows about HIPAA compliance and has all those, people in place that have the knowledge of making sure that that's all in compliance. And then, does leadership see IT as a strategic partner, or more of just a cost center? Is it something that we're just throwing money at? And then, do you feel confident that your environment is properly protected against cyber attacks? So that's one of the things, again, that's been on the forefront of everybody's radar lately, because it's just getting worse, especially with AI and how good things are nowadays with the attack vectors that we're seeing. It used to be you can look at an email and say, "Yeah, there's some grammatical errors, and we know that that's spam," or something like that, and it's not the case anymore. They're getting really good at being able to attack you and get information that they shouldn't get. So that's one thing that we, like I said, we have a team of cybersecurity professionals that are looking at that every day.
Yeah, and I think thanks for that, CJ. These are all great questions, right? That you can go back and ask. Where are we on the scale related to this? And I think you'll then be able to make a strategic decision whether or not you're aligned with the right partner, right? Okay, so with that, we want to open things up to Q&A, right? Get everybody a chance to ask questions, provide comments. We really appreciate everybody's time, and again, we're here to provide further insight. So please don't hesitate to submit questions. And I know we've got a couple, so let me read through. I'll start posing it to the group here. So the first question we had, I've heard Windows 10 is going away. We have a lot of devices running it. Do we really have to upgrade? CJ, I'll let you take that since it's somewhat technical in nature.
Absolutely. So end of life for Windows 10 is in October. Microsoft has announced that they are no longer going to be sending out any patches past October. Now that will mean that computers that are running Windows 10, after October are going to no longer be in compliance. So that could be, where your cybersecurity insurance will, charge you more for having non-compliant devices. They'll be out of HIPAA compliance. So that's one of the main things. A regular, company may be able to just run those things and not necessarily have such a heavy weight on their shoulders with having all the compliance aspects of it. But with healthcare, we need to make sure that we're staying in compliant because of HIPAA. So yes, those will be going away in October. Now Microsoft has put some different things in place where we can work some magic. So if that's something you can talk to your current MSP or talk to us about if you're interested, to be able to keep those devices in compliance and extend end of life. And then also, of course, there's upgrade to Windows 11 if those devices are within requirement. So.
Yeah, I think CJ, like you said, there are options, right? But the option of just not doing anything, should not be an option, because yes, you'll be out of compliance. You'll be exposed from a security standpoint. Microsoft will stop, releasing those security patches to close known vulnerabilities. So your environment becomes very susceptible to breach. And then also if you are, breached, everybody knows of the ramifications of having to go through and notify patients that, records have potentially been compromised and the bad PR associated with that. So it's, that's really low hanging fruit for the bad guys. So it's something that everybody's aware is coming. So yes, absolutely. You're going to want to either upgrade those devices if they're old, and they don't really have much useful life yet. If they're rather new or were robust machines, you do have the option to purchase the extended support. Really, it's like putting a Band-Aid on things, though, right? At some point, you're still going to have to upgrade that device. So you just need to make a business decision based off the remaining useful life of that equipment. So happy to further discuss, the specifics, of any individual's situation if need be. Number two, when it comes to cybersecurity, I think we're protected with the applications we're running, but how do I know if we're compliant? I think the best course of action there is to, engage with an outside partner, right? Whether that's a security specific group or another MSP, to perform those checks and balances, right? You don't want to pose the question to your existing partner, if they're an IT generalist, right? They're not going to know the nuances of compliance and what you need to have in place. And more likely than not, we'll get fed some answer that, absolves them of any exposure on the security standpoint, right? No, yeah, you guys are great. We put these new tools in place. Okay, well, how does that map to the framework that we have to adhere to, right? So, you're going to want to have somebody that has specific and intimate knowledge of HIPAA to really advise, where you're positioned against that. So I would suggest pursuing discussions with an outside group, even if the ultimate decision is we're going to stay with our existing provider. At least then you can rest easy knowing that you've gone through those evaluations and validated that what's in place does align and you are compliant. All right, a couple more came in here. So question 3, what does the downtime or setup look like when changing providers? I'm assuming IT providers. It's stressful to think how we'll plan around our schedule. So really, again, if you're going to be aligning with an organization that is healthcare specific, that understands, your organization, right? Whether you're, a primary care practice that has very rigid hours, you're open and see patients from 9 a.m. till 6 p.m. in the evening, or if you're a long-term care facility that runs true 24/7. I think ultimately it's understanding that, and then where you have windows for maintenance, right? So if your organization is structured and you have very defined hours, a healthcare specific MSP will be very cognizant of that, right? And work around those hours. So whether it's weekends, it's, hey, the office is closed Friday starting at 4, and we've got unfettered access until Monday morning when, doctors start seeing patients at 7 a.m., right? So, organizations, again, that are healthcare specific will understand that and truly work around the schedule of the practice to ensure that there is no disruption to patient flow, right? I mean, ultimately that's the most important is to ensure that patients are receiving care from the physicians. So I would say I recognize the challenge there, but if you're partnering with a group that understands it, they're going to ensure that downtime setup is minimal. And that goes into the strategic planning, associated with the onboarding as well. So being able to define that, working with the partners, and mapping that out should alleviate a lot of that stress or concern around scheduling. Bree, Chris, anything further to add to that?
No,
I was just going to say we have a dedicated project team that really steps in and handles all that. So not only just do we have our specific support teams, but then also project team that handles anything extra. As far as acquisitions or new implementations and stuff like that. So another dedicated team that we would be able to to basically facilitate that cutover and make it as seamless as possible.
Great. Looks like we have one more. I like this one. My staff have sent gift cards by accident from those email phishing attacks. How can I prevent that? That's a good one. So there's a couple layers to security, right? You've got the tools that you put in place, right, to ensure that you're protected. You've got antivirus and firewalls and SIEM solutions and security operations center and multi-factor authentication, right? You've got this whole bundle, this whole blend, this whole hierarchy of security. But the largest threat to organizations is historically been the staff, right? Because, they're the ones that are going to click on things. They're the ones that are going to, respond in certain capacities. So the best way really to combat those is through end user training. There's a number of platforms out there. Know Before is kind of the gold standard, if you will, in end user training, but it's that continuous education and working with your staff and having them go through those training exercises and attempting to fish them and see who your habitual bad clickers are, we'll call them, that click on emails they shouldn't. Ultimately with the goal of developing what I would refer to as defensive posture when reading emails, right? So not going to just respond and do whatever's asked, really looking at it and saying, well, based off my training, this seems like it might be bogus, right? So I'm going to send this over to IT to evaluate before I do anything. And I think it's also, having well-defined processes internally, right? So the staff knows, hey, if you're ever sending emails, we will never ask you via email to send money to certain bank accounts or change bank information or purchase gift cards, right? There will always be a phone call. So if you ever receive those emails and there's a question, please be sure to pick up the phone and call, the individual that the email, apparently came from, right? Just to validate. So you need to have those checks and balances in place so that, again, your staff is aware and up to date, because today it's gift cards, tomorrow it's going to be something else, a year from now it'll be something else. So that continuous training and education really helps, again, ensure that your staff is properly educated on present day threats. So that's a really big piece to this, actually. So good question. Thank you for submitting that.
Yeah, and Justin, that's becoming more of a requirement for cyber insurance companies, those trainings.
Absolutely. Yeah. If you have cyber insurance in some capacity, for those of you that have been around for a while, right? 10 years ago, the cyber insurance questionnaire was 10, 15, 20 questions. Now it's 3-4 pages of information that they want to know. And they're absolutely going to ask, are your staff trained, right? And there's direct financial implications there, right? Regarding your policy, your premium, your plans. So super critical. And I think that's it. So we haven't had any other questions come through. So we'll go ahead and wrap things up. So just wanted to Leave our contact information here for follow-ups, questions, comments. Again, really appreciate everybody joining here, and we're here to be resources for you guys. So even if it's just, hey, Justin, Bree, Chris, you'd mentioned XYZ, can I ask some more information around that? Happy to help in any way we can. So you've got our emails there. If you want to take a screenshot or jot these down, we're more than happy to have conversations with you directly. Please also connect with us on LinkedIn. We remain fairly active on that platform with updates, with information that's relevant to healthcare organizations. So great place to gain insight. And just want to say thanks to everybody, and hope everybody has a wonderful rest of the week. So we will wrap things up. Thanks again.